Namaskar. Today we will talk about a very common hormonal problem observed in almost 5% of the world population and around 7 to 12% of the Indian females. This disease is called underactive thyroid or hypothyroidism. This is the condition of the thyroid gland which goes into some kind of malfunctioning. As a result, it produces lower amount of required T3 and T4 hormones. Thyroid hormones, as you all know, are extremely important for the metabolism and for the growth of the human body. And conventionally, when the thyroid gland does not produce T3 and T4 in adequate quantity, the conventional treatment is to supplement the required amount of thyroid hormones, which is good enough. However, oftentimes the treatment becomes lifelong and patient may have to consume the thyroid hormone for life. Is there a way whereby one could get treated for underactive thyroid or hypothyroidism without having a need to take lifelong supply of thyroxine hormone? Well, homeopathy has some potentials. The experience says that there are homeopathic medicines which are known to improve the thyroid functioning in such a way that the thyroid hormone levels become regularized and normal in many patients, if not all, without having a need to take external supply of thyroxine hormone. We have seen this number of times clinically, and also we have observed this in some animal trial whereby homeopathic medicines have demonstrated their efficacy by activating the thyroid gland in animal model. And also we have seen in human experience that medicines can activate the thyroid gland, bringing the thyroid levels to normalcy without having a need for any external supply of thyroxine. Does this happen in every case? Well, I would say no. We still do not know which of the cases which will respond to homeopathic treatment and which cases may not work. But overall clinical experience says that if the patient is recently diagnosed, then there are greater chances that he or she may respond to homeopathy without starting the thyroxine hormones. Also, we have seen that if the patient has been taking thyroxine hormone for less than 2 years of time, then there are still chances that the thyroid gland could be still activated using homeopathic medicines. But if one keeps taking the thyroxine hormone for a longer time, making your body dependent on thyroxine hormone, then the thyroid gland is known to become kind of lethargic and it stops producing its required hormones. So in that case, there is less possibility that homeopathy would be able to activate the thyroid gland. If one is already taking thyroxine hormones for less than 2 years, then also they can start with homeopathic treatment, and after maybe 2 months of medication, slowly the current dose of thyroxine hormone could be tapered, could be reduced very systematically and strategically, and keeping an eye on the thyroxine levels in the blood, T3, T4 and TSH level especially in the blood. And once you find that even after reducing the thyroxine hormone, these levels are normal, then at one fine day you can stop this thyroxine supply from outside. We have documented this kind of benefits in number of patients and it works quite well. And that is a common experience of so many homeopathic doctors across the world. So all in all, we can say that earlier the better. If you are recently diagnosed with underactive thyroid, then homeopathy is a great choice to make, to check if your thyroid gland is in position to get activated using certain medicines. And if it works, then maybe there are chances that you may not require thyroxine hormone for life. In case you do not respond to the treatment, then of course that has to be monitored, and by monitoring it for a few months, we can say that if at all one does not respond to the treatment, then one may have to start with the thyroxine hormones to be taken orally for a long time. I hope this video will help the viewers who are contemplating the treatment of underactive thyroid using homeopathy. Thank you for watching.